think there's a number of reasons that workplaces should be paying attention to domestic violence. We have staff amongst us who are experiencing domestic violence first and foremost, and we want to make sure that they're safe. And it's partly because they're part of our community, and we want to make sure that they understand that we care about them, and that this is a place where we will take measures to ensure that while they're here, when they're coming to the workplace, when they're going from the workplace, that we want to make sure that we have taken all precautions that we can to make sure that they're safe, and that when they're here they can really focus on their work and not have to be worrying about whether they've been followed here, whether somebody is going to come in and threaten them, whether or not their children are safe, that we are really concerned about them as part of our community. And also that we want to make sure everyone's safe. So we certainly don't want to bring, if there is a threat of violence, we don't want to bring that into the workplace where that can threaten that employee or others in the workplace as well. We are in healthcare, and we also know that, it says right here on my lanyard, violence against women is a healthcare issue. And we want to promote the good health and well-being of the people who work here as much as we do of our patients. We are all just part of the same community. The materials that we use to work with our staff are the same materials that we develop to work with our patients. Those are resources that we've developed around where people can go to get support around violence against women, where people can go with domestic violence, abuse, sexual violence, etc. So some of what we do is we have posters throughout the building, and we do seem to get a lot of messages across through posters. People see them in the elevators, they see them in the elevator stairwells, we have them in washrooms, and we're sending two messages. One is to our patients to say, this is a healthcare issue. You can talk to your healthcare provider if you're experiencing domestic violence. We're also saying to staff in the organization, it's safe to come forward here. We want to support you. This is not something to be ashamed of or to feel like this is your fault. We're here to protect you and provide safety in a non-judgmental way. Beyond that, we have an online course that includes harassment, violence, domestic violence. That's an opportunity that every 2 years all staff have to complete that course. So they go through that particular module, and they find out both their responsibilities around being a colleague or a manager to people who are experiencing domestic violence, as well as their rights as an employee here and what is available to them as somebody who might be experiencing domestic violence in the workplace. Where do you go? Who do you talk to? What if you're a colleague and somebody tells you that they're experiencing domestic violence? What are some of the warning signs that might tell you that that's taking place? So we cover all of that in the online course. We also have, and Marina actually has done training with all the frontline clinical staff this year, particularly with nurses, and that was both looking at how we treat and work with patients, as well as how we work with each other. It's called Caring for Patients and Each Other.